Okay, so hi, it's Lisa. This is a video for I think of my jaw surgery video blog. My last video, I talked about all the alternative therapies that I went through for the past 7 years. If you didn't see my last videos, I've been going through this for the past 7 years, trying to fix my bite. And in a week from today, I will be having jaw surgery, upper jaw surgery, to fix my natural bite, which is an open bite, which is a completely open bite. So if you didn't see my bite before, my other videos, here's my bite. Eccentric relation, with my condyles properly seated, or kind of properly seated. They're still not properly seated, but here's my bite. It is completely open. I have one contact in the back left, and I have not always sit this way. If you watch my videos, my other videos, I've hit in many different places because my lower jaw is trying to find a place to fit into my upper jaw. So the last video I went over all the alternative therapies that I was doing as along with the splint therapy to help me with my journey and all the things that I've been through. So on this video, I'm going to talk about my surgical team and surgery and like surgical molds and stuff like that. So it's important to have a team on your side if you're going through this at any age. Even most people go through this at like 18. I'm 40, so I'm gonna have some permanent damage from having a skeletal deformity for so long and not knowing, and my jaw being in the wrong place, my lower jaw being in the wrong place for so long. I will have arthritis in my jaw joints, but both jaw joints, for the rest of my life, but that's okay. It's manageable, obviously, arthritis, but what I have now is not manageable because I can't eat at all. So I have a great surgical team. I went to see 2 oral surgeons before I came to the surgeon I'm with now. One oral surgeon said that it was too complex for him, my condition, and another oral surgeon said that I would need to have double jaw surgery, but more importantly, I would need to have jaw joint replacement surgery, and that he said it would be very stressful on him and on the orthodontist. So I was like, not my guy. So the oral surgeon I'm with now was very confident. He said that he does these every week, and he was like, this is, this is a skeletal deformity and blah, 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 blah. So I think it's important when you go see an oral surgeon, you feel good about what they're doing. The first 2 oral surgeons didn't do very many measurements. The third one, who I'm with now, measured everything. I mean, he did all kinds of measurements of my face and my ears and every tooth, and lots of measurements. So I went ahead and felt really good about going with him. He also worked with a TMJ specialist. He also knew the TMJ specialist that I had been with. So I think it's important to have a team that works together. He referred me to a surgical orthodontist, one who only deals with surgical cases. Well, he does other cases, but he specializes in complex cases like mine. He deals with like cleft palate cases, and he's been doing it for like 30 plus years. So he's phenomenal. And so he's really good friends with my oral surgeon, which I think is important because they communicate a lot, and they team just specialists communicate with them, and they all talk about my case in these past like 5 months. So I feel like I have a really good team of people. The surgical orthodontist and the oral surgeon want me in the splint that I showed you. I don't have it here. I can go get it. That I showed you last time. They want me in it all the time because they want everything to be as freed up as it possibly can be before surgery. So I'm supposed to be wearing the splint. All the time because it gives me a balanced bite, or somewhat of a balanced bite. And take it out. So they want everything all my muscles and everything to be as freed up as possible, which is really hard because I have an open bite and my muscles are going like not so crazy. So have a good team. Have a good team of people and feel good about that. So surgical molds are like, they're just impressions made of your teeth. And then they make like these surgical models that they put on the articulator. And of course they do the bow thing with the measurements where they put the things in the ears. And mine is really, they put like this horseshoe bite thing in your mouth you're supposed to bite down on. But since I don't have a bite really, they had, they like change the measurements and stuff. It's actually really complex. So I feel really good because they do so many measurements. And I did that twice because the first time they did the surgical molds, he wasn't happy with, it wasn't completely as accurate as he wanted it to be because he practices on the surgical molds. And so he had me come in again and take more molds and wait, because where I go, they do the molds there. They dry there and everything, and they make them there. So I just waited for 30 minutes until they got it all together, and I was hitting exactly where he wanted me to hit before surgery. And so that was last week, and that's it. That's pretty much what surgical molds are, because they practice on the surgical molds, and then your next visit they will talk about it, which my visit is on Wednesday. Tomorrow I get surgical hooks, surgical hooks, which are just like these little hooks that go in between your braces. Right now I'm in the steel wires. I've been in them for like, I don't know, 5 weeks, 4 weeks, some craziness, long time. So as far as I know, pretty much I'm having upper jaw surgery. They told me that could change in the end, but obviously I'm all the way a week out of surgery. So they will be cutting, as far as I know, they will be cutting portions of my upper jaw, more on this side than on this side, because this side's, I'm asymmetrical, I guess, within my maxilla. So they will be fixing it, and I will know exactly what they'll be doing on Wednesday when I go in to see the oral surgeon for the last time before I go into surgery Monday, December 5th. So because I'm so much into the whole body treatments and stuff like that, I went ahead and made 2 massage therapy appointments, cranial sacral work, which I talked about in my last videos, for tomorrow. So I have one tomorrow. These are very painful massages. They're not like woo spa massages. They're really painful because my muscles are so tight, and they're going to free up as much as they can tomorrow. And then I go back on Saturday for another one, an hour and a half of body work to free everything up so that I can be as free, I guess, muscle tension and stuff like that, as I can be before surgery, which is Monday. So that's my plan. I don't really eat very much because I can't chew. So I'm pretty much on a soft food liquid diet right now. And of course, once I have surgery, I'll be on a liquid diet, but it doesn't really bother me because that's really a lot of what I do now is liquid. And there's a book called Dinner Through a Straw, if you want to get that. I've tried 2 of the recipes and they're really good. So that after surgery, I can feel like I'm not just drinking Ensures and Carnation instant breakfasts all the time. You can actually put meals and puree it into liquid so that you can get some more calories and some more nutrients and stuff. So it's called Dinner Through a Straw. So I'm doing 2 massage therapy appointments. I see the oral surgeon on Wednesday, and I will do a video after that to let you know exactly what they're going to be cutting out of my upper jaw so that my lower jaw can come and close and I can eat and my muscles can all relax, because they're not relaxed. They're trying to be, but it's really hard when you have such an open bite, because your lower jaw is trying to close into your upper jaw all the time. So that's it for today. If you have any questions, I'll try to answer them. I am a mother of 2 children, so I barely have time to make these videos, but I will look to see, because I think you can ask questions and stuff, and I don't even know if anyone's watching these actually. I haven't checked, but I will see if you have any questions. I really just want to help anybody if I can, and I will see you at my next video.